Another assessment performed here in our baseline is what's called pulmonary function testing. First, we look at what's called forced vital capacity, which is a rapid inhale followed by a very aggressive exhale maneuver, where we're going to look at things like your overall lung capacity and rule out things like obstructive and restrictive lung conditions. An obstructive condition is anything that blocks the small airways, whereas a restrictive is anything that does not allow the lungs to open and close all the way, therefore limiting the surface area or the oxygen diffusion capacity. So first, what we want to rule out is these underlying lung conditions, and then look at things like inspiratory relative to expiratory muscle capacity. This is something that we'll target utilizing our respiratory muscle therapy called the NF1 breather. Santana is going to give you a quick example of the forced vital capacity assessment. Rapid max inhale, as forceful as you can, get it out, and push, push, push. Big inhale. Good job. Then we will perform what's called maximum voluntary ventilation, which is a 12-second max effort assessment where essentially we try and push as much air in and out as possible. Number one, it gives us some insight into overall lung conditioning, but more importantly, it allows us to assess inspiratory relative to expiratory capacity. What we can see here from Santana is that he has an obvious downward slope, which would show that his inspiratory capacity is not sufficient to accommodate with his expiratory, so we want to focus on strengthening these inspiratory muscles. All right, Santana, we're going to have you perform a quick 12-second maximum voluntary ventilation. Whenever you're ready, go for it. And stop. Good job.